Hello, I'm Dr. Roy Picard, and I created this video for the residents of Romeo, Michigan. What I'm going to discuss are the different types of tests that are often overlooked when it comes to helping a child who has either been diagnosed as having ADHD or perhaps it's just suggested or suspected that they may have ADHD. Now, brain function is the most important thing that needs to be addressed with these kids. In some of my earlier videos, as well as the information on the Michigan ADHD website, I talk about the functional disconnection syndrome, which is common to all of these kids, and how important it is to get their brains balanced. And brain function is dependent on two things: stimulation and body chemistry. The body chemistry has to allow proper fuel to the brain in order to function at its optimum. So how do I determine which areas of the brain require additional stimulation? There are specific non-invasive tests which are geared for specific age levels that are going to tell me which areas of the brain require additional stimulation. Some of these tests will assess if there's a visual processing problem, an auditory processing problem, a motor skills delay, lack of coordination, a problem with timing or rhythm, deficiencies with fine or gross motor skills, and much more. As far as the body chemistry evaluation or the metabolic analysis, again, it's pretty much dependent upon the child's ability, but we may need to evaluate such things as blood sugar, cortisol levels, the amount of good bacteria in the gut. We need to check if there's any bad bacteria or a fungus or parasites. We may want to look at thyroid function, assess how well oxygen is getting to the brain. We can look to see if there's a high count of bacteria or viruses, check iron levels, liver function, immune system function, kidney function, and much more. What I want you to understand is this: there's a great deal that can be done for these kids, but unless you are getting the right types of tests, unfortunately, your child will not have the opportunity to reach their optimum physical, mental, social, emotional, behavioral, or academic level of performance. Also keep in mind that these tests that I've been talking about, they do require a functional assessment as opposed to just the traditional medical analysis. So for more information, you can go to Michigan ADHD. And if you're interested in setting up a free consultation, then please call my office and speak to my friendly staff at 586-726-9860. Again, I'm Dr. Roy Picard, and I wish nothing but the best for you and your child.